Hey there, it's Melissa Bautista, and I'm going to go ahead and demo things to consider when maintaining the NG tube. Hi, Mr. Summers. I'm Melissa Bautista. Looks like the provider just put an order for every 4 hours intermittent suctioning. So just a few things I want to check out while I'm here in the room with you, but can we please first verify name and date of birth? Okay, wonderful. All right, so just a few things we're going to do is we're going to irrigate the tube, which is going to ensure that everything is still flowing as appropriate. Right now the suction is still on, so I'm definitely going to turn that off. But I just want to see here that nothing has moved where we taped it. This is connected to your gown, and it doesn't look like anything is loose. All right. So what we're going to go ahead and do is we're going to turn off the suction. I'm going to do some hand hygiene. Put my gloves on here. And now that that's turned off, we're going to disconnect the suction from the NG tube port. And just like we did before, we're just going to aspirate and ensure that nothing has moved and that the tube is still in your stomach. We'll use a pH strip to verify all looks well. And with that being said, I'm going to take about 20 mLs of irrigant, and I'm going to irrigate your tube. That feel okay? All right, wonderful. And because it is a double lumen tube, I'm going to take about 20 cc's of air, and I'm going to inject the air into that second lumen so that when we reconnect, the suction is working strong. All right, I'm going to go ahead and reconnect the tube, pull the order back up, and just confirm that nothing has changed. So what we have the continuous suction. All right. And then the next thing I'm just going to do is ensure that you've done oral care. We want to make sure that you're keeping your teeth clean and your mouth clean. This tends to make you a mouth breather, and not keeping the oral cavity clean can lead to infection, so we want to make sure that we're doing that. I know your mouth looks really dry, so I do have some Vaseline, some ice chips that you could use just to stay comfortable. Are you able to tilt your head? Okay, you have room to where the tubing is comfortable. All right. Okay, and I'm just going to take note of the input and how much volume there is, the color and the texture. I'll also make note of that in the EMR. And so far so good. I'll be back in the next 2 to 4 hours to check up on you.